Episode 72 of the podcast. This week we're talking about medical interventions for dogs with behavior issues on the grooming table. Should we be thinking about medication if a dog has a behavior issue? Is it a helper or a villain? And how can we address that with customers who maybe don't understand that meds can be helpful or that meds aren't necessary and your dog just has a normal behavior problem? There's lots to think about, and we all need to stay in our own lane, and that's what we're discussing this week. You're listening to the Creating Great Grooming Dogs podcast. I'm Chrissy Newmeyer-Smith. I'm a certified professional groomer, a certified behavior consultant for canines, a certified professional dog trainer, and the owner of Happy Critters in Nashua, New Hampshire. And this, my friends and colleagues, is the podcast where grooming and training meet. Some real data, gather clues. Think about what the dog is actually showing, the behavior that we are seeing, so that they can talk to their doctor. Our professional observations can be a huge help to the veterinarian because an owner's point of view and the story that they share can truly sound like anxiety when relayed to the doctor. But when we add our observations, then the doctor can get a different picture of what the behavior is. And this is their trusted medical professional. This is the person that they should be going to. People have such strong feelings about medicating dogs for behavior issues. I mean, really such strong feelings. Now, I've run into the people who want to address every single issue with a pill, and the extreme opposite. My dog doesn't need medication no matter what the dog is doing, and everything in between. And I'll also say that many dog pros, both vets and non-vets, have some pretty strong opinions about it too. Now, I'm not here to play vet, and I'm not going to mention specific medications. What I want to discuss is the owners and their choices, and to help the people think more about medications as helper or villain. First, let's talk about the owner who wants to treat everything with medication. Where are they coming from and what drives them? In my experience, many of these people don't have a ton of knowledge about normal dog behavior. Sometimes this is their first pet. They have this dreamy reality of, oh, this is what a dog would look like. And if their dog deviates from that, that's when they start having some problems. They don't know normal dog behavior. So they're often seeing excitement as anxiety. Anytime a dog stares out a window and whines, these owners are pretty sure that their dog is being weird and that whining must be stress and anxiety and crying. You know, they think whining is crying. And many of these owners are prone to get it into their dog's paws. You know, they start trying to build the story around what they think is going on. Like they try to see the world through their dog's eyes. Like, oh, he must be crying because a man walking a dog beat him with sticks, or, you know, like they come up with lots of different stories, but a lot of these are based on trying to understand dogs and just not quite getting it right. These folks are kind and loving, and they want what's best for their dog. Now, once they find out and accept that their dog is showing normal behavior and needs to be taught a different behavior, they're usually relieved and on board. And I see that a lot, that it takes a while for them to really figure out that what you're saying applies to their dog. But once they figure that out and accept it, they're like, oh, okay. All right, so how do I make him happy? As long as we're trying to help them help their dog be happy and comfortable, they're going to go along with it. So examples include the average dog doesn't want to be left alone when you leave, but doesn't necessarily have separation anxiety. And I'm going to use separation anxiety as an example because, oh my God, every Tom, Dick, and Harry thinks their dog has separation anxiety. Separation anxiety is a pretty serious problem and not nearly as common as owners think. Puppies need to learn how to be alone. It's really normal for puppies to start whining and crying or barking if they're left alone. So we need to help owners understand that this is a normal behavior, and we need to teach the dog to be able to be comfortable alone, but that true separation anxiety is a dog who cannot calm down. Like, you know if your dog has separation anxiety because you went to the store or went to the mailbox and came back, and this dog has been freaking out the entire time, has hurt themselves, is bleeding, has ripped apart every door frame trying to get out. I mean, separation anxiety is truly anxiety, not necessarily a I whine when you leave or I bark when you leave. So it's one of the examples that I see an awful lot of, and owners looking for medications for their separation anxiety when really their dog is displaying pretty normal behavior that needs to be reduced through training. The dog needs to learn how to be comfortable with being alone. Every time they pick that puppy up and, oh, he just can't be alone. We've all seen these people like that. He can't be alone, so they never teach their puppy to be alone. And that can turn into a real anxiety problem later. But separation anxiety is a common one. Now, many of the owners who are quick to think that their dog has anxiety in general and needs medication are also owners who are a person with anxiety or know someone with anxiety. And they know that the correct medication can make a huge difference in someone's life and level of comfort. They simply want their dogs to be happy. And I get that. Have you ever known somebody who has depression or anxiety and their search for something that will help them? And when they find something that will help them, they're just a whole new person. I honestly don't have anxiety and I don't relate to it well, but I have some loved ones who suffer from this. And the correct medication is, of course, going to make their life better. So a lot of these owners, if we think about that they're trying to make their dog's life better. So the way to reach these folks is to honor their feelings, right? Like, I understand you just want your dog to be happy and safe and free of anxiety and frustration, right? Honor that. And then help them gather clues about their dog's behavior and responses. I'm not going to say that a dog needs medication or doesn't need medication. I don't say they should go to this vet or that vet. I think that that's pushing the boundaries of what we should be doing. If you're not a veterinarian, you should not do that. Ta-da! There, I said it. If you're not a veterinarian, you shouldn't do that. However, you can list your concerns, and that's what I do. I list my concerns. This is the behavior as I see it. And if we can look clearly and observe the behavior and strip it of its stories, that's where we as professionals can help the veterinarian help our customers, because they might need the medication. I'm going to give you an example. A customer that I had whose dog was on meds. Their veterinarian was like, wow, yeah, you're right. That sounds really weird. They all kind of agreed it sounds really kind of weird. But as a house call groomer and a house call trainer, I went in because what they were seeing as weird was a dog just standing there staring and whining. I mean, he can do that for hours. It's like so weird, and he just stands there and whines. But I looked closer and I said, he's facing the sliding glass door. Yeah, but he does it when nothing's happening outside. Ah, well, let's all go over to the window, over to the door, and kind of just stand here with him and observe what's going on outside. Because what I pointed out was the squirrel, the birds, the chipmunk, the kids on bikes across the way. Like, as far as this dog was concerned, there was a ton of stuff happening outside that window. But I think the owners, not knowing much about dogs, were only seeing what was happening like within 10 feet of the window. And that their dog was just staring out into space and whining. Right? So sometimes it's a matter of learning more about the dog, learning more about dogs in general. Because many of us, it's a first dog they've ever owned, and they're an adult, and they're like, oh my God, this isn't what I thought I was going to get. This isn't what I thought was going to happen when you own a dog. And because their narrative to their vet made it sound so abnormal, because I'm sure if the vet walked into their living room and saw the dog staring at a sliding glass door and crying out into the grass, like they would say, that doesn't look like anxiety to me, right? But to have a different point of view, to have a different set of eyes there, means that we can guide them to something a little bit different. Like, okay, does your vet know that what he's staring at is stuff that he wants to chase? which in this particular dog's example, I mean, he was a young dog, young, athletic, and just wanted to chase everything. So he's at the door, looking out this sliding glass door, watching the world go by with some pretty sharp, keen eyes for distance and motion, and just fixating on all of it. Like, oh, I want to do that. Oh, I want to chase that. Not anxiety. And I think if their veterinarian saw the whole picture, they would have agreed that it's, yeah, that doesn't sound much like anxiety. So when they brought that new information to their veterinarian, they decided to like, okay, let's reevaluate. And that's our role with the people who are like, let's just give him some medication. I think my dog is very, very anxious. And again, like I said, many of these people have anxiety experiences of their own or in their family. And we need to honor the fact that they have seen somebody suffer from anxiety and have them, searching for the medication that can help them. So that's one side of medicating and if it's going to be helpful or not. Sometimes people overdo it. If you're enjoying this podcast, please remember to subscribe so that you don't miss any episodes, and tell all of your friends. When we talk about adding medications for a behavior issue, there are a lot of people who won't even consider it. Many of those owners are picturing their dog walking around like a zombie, the dog who's sedated and acting drunk, or a dog who's really, in their opinion, unable to enjoy life. Sometimes I think that these folks think that meds are wishy-washy, granola crunchy, right? Like sometimes they think the dog pro is suggesting a medication for a behavior issue because we're lazy and we're trying to make our little lives easier. Yeah, okay, I said it. But we know that there are folks out there who feel that way. And we need to understand where those folks are coming from. So let's take a break from giggling. Because, we're not just doing this to make our own lives easier, but to take a break from giggling and to see their point of view. Many people think that their dog's behavior is totally normal. And this is totally opposite from the other group who sees everything as abnormal. These folks may say things like, he's just like that. He's high strung. That's his breed. He just needs a stronger hand. Maybe I'll come in and help because he would never, do that to me. Or, we keep him away from scary stuff. So it's only when he's here. It's just when he's here. So it's not a problem. And, let's also not forget the more common one, which is we know someone with a dog who was put on meds and it didn't help. So a lot of these people have a skewed view in the opposite direction. Like everything is totally normal. Think about how many people will tell you like, well, of course he hates having his nails done. All dogs hate having their nails done. And that's not true. Like, oh, of course he hates it. Like I remember meeting a guy who was like, of course my dog has fleas. Don't all dogs have fleas? I mean, dogs have fleas. So sometimes it's an education issue that they don't really understand that some of this is not normal. And I'm not talking about like the medications for other types of health problems, but really if we're talking about like behavioral issues, because I think most people would put their dogs on like, heart guard, things like that. But for a behavioral issue, many people just draw a hard line. So what we need to do to help these folks is understand that there could be a medical issue that is causing a behavior problem, and that the vet may be able to help them by being more comfortable and reducing the behavior problem. We think about our role as dog pros who are not vets is to help our owners understand their dog's behavior. I want them to understand what we are seeing as abnormal. Because when the pro sees something abnormal, that means something for the vet. Because if a groomer says, this dog is acting really kind of weird about XYZ, that's different than Joe Schmo saying, I don't know, he's like this for XYZ. Because we see dog after dog after dog after dog. And when we notice something abnormal, that's important. That's good information for the vet. And we want our owners to know that we're seeing something abnormal and we'd like them to talk to their dog's doctor about behavior issues, because their vet may find a medical issue and or have some medication recommendations to help their dog be comfortable. Now, the reason why I keep pushing the idea of comfortable is because we don't want to use medication simply to get the job done, to make a dog drowsy. I find that makes dogs even more scared. Thinking back to the days when we used to do that, that's where some of these people are coming up with this, like, no, I'm not going to medicate my dog. No, I'm not going to do it. because they remember or they saw or they, have witnessed a dog who was really, really drugged up and still hated every minute of it, right? The dog who's still like, we were able to get it done somehow, but that dog is still freaking out and eventually wouldn't take the medication. I can think of a number of cases back when I first started working with dogs with a dog who was like, nope, I'll take my heartworm pill, I'll take this, I'll take that, but I'm not going to take that one. I know the scent and the taste of that one, and I know what comes after that. So I want you to be thinking about these folks need some help understanding that their dog could have a health problem that is causing this behavior issue. Now, I've discussed fear and anxiety with people who suffer from it. Some of them are close family. Some of them are just, casual discussions when we're talking about their own dog. And the truth is that anxiety sucks. That should probably be the name of this podcast episode. Anxiety sucks, right? All of those people are looking for something to help it. Because no one wants to live like that. They're all looking for something that can help them reduce anxiety, fear, and stress and help them function better. They want to be comfortable. And we need to keep an open mind about the use of medications for behavior issues because many behavior issues have a medical component. And it's really important for us to express that to customers so that they know we're saying, I'm seeing something that I'm really worried about. I'm really concerned about your pet. So the dog that goes from being really, really relaxed to suddenly screaming, right? That's some sort of anxiety going on. That's something abnormal. It could be that it was learned. It could be oh my God, they just touched my tail and I'm going to scream. But I want you guys as other dog pros who are not vets to be really thinking, I'm going to document and talk about the behavior I observe and why I think it's abnormal or extreme so that when they go to the vet, they're a little bit more open-minded that this could be a medical issue. Now, I'm also going to remind everybody here that a medical issue is also probably still going to have a training component. If a dog is used to this causing anxiety, stress, fear, frustration, it's not going to magically go away when we, help them feel more comfortable because they have a history of, oh God, I hate this. Oh God, I hate this, right? So we're still going to have to do training work. We're still going to have to work with the dog. But we can educate our customers that medicine changes constantly. Constantly. And when I first started working with dogs, like I said, I was not doing things the same way. We used to sedate dogs, get them all woozy, drugged up, using medications that we no longer use to get the job done. Not thinking about making the dog more comfortable. Well, I guess we were thinking it was making the dog more comfortable because, they weren't struggling as much and it was safer. But it wasn't to lessen the anxiety in the dog. Now we have drugs that do. We have ways to work on that. And it's not our role to tell someone their dog needs medication or not, but it is our role to say, I'm seeing something abnormal, and there's a variety of medical interventions that your vet may choose to help you with. Now, another thing I want to make sure that my fellow dog pros, we all know, is that when you send somebody to a behaviorist, you are not sending them to a trainer. I am a behavior consultant. In the United States, a behaviorist is a veterinarian who went on to study behavior specifically. So think about a behaviorist, like there's the veterinary cardiologist, there's the veterinary dermatologist, there's the veterinary behaviorist. Or it's someone with a PhD level in behavior. So it's not a dog trainer. So if you say, I really want you to go see a behaviorist, if they're like, this guy says he's a behaviorist, that's not going to cut it. And it shouldn't be the groomer or the trainer saying, I want to send you to a behaviorist. The groomer or the trainer role should be, or the dog pro should be, I want to send you to your vet and discuss if they think you should move on to a behaviorist, a veterinary behaviorist. a specialist in behavior and neurology and all of the things that are way beyond dog training. So this is the reason why I wanted to do this podcast this week, is because there are medications that can help a dog be more comfortable, help a dog lessen their anxiety. And the people who are constantly looking for a pill to fix it are often medicating a dog who doesn't need it and therefore don't see any effects, right? Like if you're giving a dog medication and what they have is a training problem, it's not going to change. You can't just, ta-da, it's gone. I wouldn't have a job as a trainer if there was a medication that made it go away, right? Like we'd all be like, I will take this pill and make that go away. And when we think about the medications, we also need to be thinking this is all about comfort level for the dog, not for making it easier to get the job done. A dog who's more comfortable is likely to have an easier time with grooming and have an easier time with training and being taught a new behavior around grooming. But we need to make sure that the vet is the one who is making those suggestions, not us. If you'd like more information, you can find me at Chrissy@happycritters.net, happycrittersdogtraining.com, or you can join the Facebook group, Creating Great Grooming Dogs podcast, or the Facebook page, Creating Great Grooming Dogs. I really look forward to hearing from you.